Hi, my name is Mr. L. I'm the BTEC Level 3 Sport Lead Teacher. I'm going to talk through the course, what it involves, and give you a brief introduction of what a typical lesson could look like if you were to join the course in September. So, why study BTEC Sport? Well, it's a vocational course which will give you the knowledge required to pursue a career in sport and in the sports industry, which is massive. It will develop range of sport-related pathways from sports coaching to gym and leisure management. And you could further your studies at university after the 2 years here, and you could study a degree in physical education, be a PE teacher like myself, or you could become a physiotherapist or study further sports science. So where does BTEC Sport courses lead then? It's a massive industry sport is, with 600,000 jobs in the UK alone within the sports industry, and it's worth an estimated £28 billion. So it's good to get into. So the course then, it's an extended certificate in sport, which is equivalent to 1 A-level. You will complete 4 units over the 2 years, and these will include anatomy and physiology, fitness training and programming for health, sport and well-being, professional development in the sports industry, which is what I was talking about, looking at where you can go with the course, looking at jobs. You will actually research some jobs and apply for them and go through the interview process and assess how well you've done, looking at CV writing and interview techniques as well. And then Unit 7, which is a practical unit, which is practical sports performance. So, bit more of a breakdown then. The 2 units in year 12, Unit 1 and Unit 7. Unit 1, the anatomy and physiology, which is an exam unit. So at the end of year 12, you would sit the exam, an hour and a half, just like any normal exam. And like I say, that was on anatomy and physiology. Unit 7, which is practical sports performance, which is 100% coursework. You'll do that throughout the year, and that looks at how we play sport, how sport has evolved, looking at rules, regulations, and also skills, tactics within the sports. You have to look at 1 individual Olympic sport and 1 team Olympic sport. So we've had in the past, for the team sport, we've had basketball, football, rugby, and netball. And for the individual sport, we've had boxing and badminton. So some ones to choose from there. In year 13, it's again another 2 units. Unit 2, fitness training and programming for health, sport and well-being. Again, it's an exam at the end of year 13. And Unit 3, the professional development in sports injury, which was spoken about earlier, and that is 100% coursework. So what, if you're really interested, what I'd like you to do is to stay fit and active over the summer. If you are a team sport player and you can't play your team sport because of the current situation in COVID, then just stay fit and active, go out running, skipping, cycling, anything you can do just to keep yourself fit and active. And that keeps obviously body fit and active, and also keeps your mind ticking over as well. I'd also like you to watch and observe any sport. There's a lot of football being shown at the moment because it's just started up. Look at how the game's played. So look at the rules. Who decided the rules that they play by? Do the rules change? Why do we need the rules? Look at the equipment used. Does the equipment change anyway? Pitch and court dimensions, or whether it's played, different surfaces. Look at the officials involved. Referees, 4th official, video replay, which is controversial at the moment with VAR, and technology involved as well. Look at how the game's played. There's different skills and techniques and tactics to play the game. Attack, defense. Do these change? Why do they change? So we're just kind of looking at the bigger picture of sport, not just watching the game. And then hone up your skills and keep them ticking over if you've done it in year 10 and 11, whether you've done the BTEC level 2, OCR level 2, or the GCSE PE. Look at and go through, look at your revision notes, and I've put 3 websites here that you can have a look at and look through while you're off on your summer holidays. So documents to work through. I've hopefully attached some of the documents for this PowerPoint, so for you to download and print out and work through them as we talk through the actual PowerPoint and the lesson. So introductory lesson then. It is anatomy and physiology. Things you'll need for this lesson would be pen and pencil, paper to take some notes, and like I've mentioned, to print out the worksheets from this video. If you see a pause button here, can you pause the video because I'm asking you a question? You need to sort of sit and think about it, write down your answers, and then you'll restart the video at the next slide. So, quick starter, get you thinking, which is the odd one out and why? And hit the first pause button. So, welcome back. Hopefully you would have picked out the female rounders player, not because she's female, but because she's actually participating, and the other 2 are the officials. So something quick to get you thinking, get your brains into gear. Okay, this unit then, what's it about? It's building on your previous knowledge. You've probably got knowledge from, even if you haven't done any of the sports, BTEC, OCR or GCSE, you will have had some knowledge from your science. So we're building even on that, looking at bones, types of bones, function of the skeleton, skeletal system, looking at the muscular system, how we move, and relating that to sports actions, and then the cardiovascular system of the heart and lungs and blood vessels. So as this is a vocational course on which I've mentioned, I like to put on some of the PowerPoints and presentations and relate it to sports. This unit really works well if you're thinking about going into physiotherapy, obviously looking at muscles and bones. I'm not going to read it through, but average physiotherapist could earn this sort of money here. That's at the NHS level. If you go into the private sector, or if you go down the sports teams, you can get in with a professional sports team, you could be earning obscene amounts of money. So it's worth thinking about. Okay then, so these are the learning objectives, and I'm not going to read them. You can have a look through them, but they're obviously standard on all lessons that we have the objectives on there. First one for you to do is the human body worksheet. List of the bones here. You just need to put them onto the worksheet and label it up. So press pause, and once you've done those, then you can resume the presentation and we can go from there. So welcome back. Here's the answers. Hopefully you won't have skipped through and you'd have actually sat and done them. Some of them you will know, some of them you probably won't know, some of them are a little bit more in depth because it is the level 3 course. So moving on. Introduction then to the human skeleton. We've got, it's made up of bones, cartilages and joints. Without bones, we would be a shapeless heap of muscle. And it provides a framework that supports the muscle and the skin, all of which you should have learned if you've done level 2. And then the skeleton is split into 2 parts. This is where it gets more advanced, the axial and the appendicular. Does anybody know which these are? So if you do, just write those down. And a couple of questions for you here. Question 1, how many bones are there in the human body? Should know that if you've done GCSE and level 2. Just testing prior knowledge. And does anybody know how many bones does a baby have? Hit the pause button, write the questions, and more importantly, write down the answers. So, welcome back then. Bones in the body. Babies are born with 270 soft bones, 64 more than an adult. So you should have had 206 for the first one of what an adult has in their body. So bones fuse together by the age of 20 to 25, right, into the 26 hard permanent bones that we have as an adult. So it takes a long time for the body to develop, right? So this is called ossification, where bone growth develops. And we've got a question here. Hit the pause button. Why is it important for people to take part in sports? So hit that pause button, write down the question and the answer. So welcome back. The question was, why is it important for people to take part in sport? And the reason is that sport is really good for maintaining healthy bone growth and bone density. So lots of impact sports like running, football, rugby, where your bones, certainly in your legs, are having that impact, actually makes them stronger. So that's why it's really important for people to take part in exercise. One condition that mainly affects women, sort of older women, is osteoporosis, which is where bones become very brittle. So that's why it's really important just to take part in a little bit of exercise. Walking or fast walking is good for everybody. Okay, all bones have their own characteristics and purpose. So we're going to be looking at that in more detail in the next few slides. Okay, another worksheet for you to do here, just matching them up. Hit the pause button and, like I say, just match them up, look at them. If you need to have a look on Google, you need to get them matched up. Okay, welcome back then. The axial skeleton. So what is it then? It's the axial skeleton forms the main core part of the skeleton in your skeleton. So as you can see, I'm going to move me up here, hopefully. It stabilizes the appendicular skeleton and provides attachments to the muscles. So it protects the body's organs, and it consists of the skull, the sternum, and the rib cage, and the vertebral column. Okay. And there are 80 bones to the axial skeleton. So question time. Again, there is a pause button. What organs do they protect? And what bones are part of the vertebral column? So if I go back and show you there, which internal organs do they protect? I'll give you a moment or two and go on to this next slide. Okay, welcome back then. So what organs do they protect? Hopefully you will have got the brain, the spinal cord, the heart and the lungs. So the rib cage protects the heart and the lungs. The spinal cord will protect the spine, and the skull or cranium will protect the brain. What bones are part of the vertebral column? We've got the cervical, thoracic, lumbar, sacrum, and coccyx. Right, so little task there. For each of the following bones, I want you to take some notes for me. Axial skeleton, the cranium, right? It also known as the skull. It consists of 8 bones fused together to protect the bone. So we have the frontal, brachial, temporal, occipital, ethmoid, and sphenoid, and they're the 8 that protect the brain. All right, there are 14 other facial bones that form the face and the jaw, which is also known as the mandible. Okay, so need to get that, pause it, get down some of the notes, and then we can move on. Okay, welcome back. We're going to have now time to look at the rib cage. The ribs form a cage around the heart and the lungs to provide protection. It consists of 12 pairs of ribs split into 3 groups. We've got 7 pairs of true ribs. They attach to the sternum and vertebrae. 3 pairs of false ribs, which attach to the vertebrae and the ribs above. And then 2 pairs of floating ribs attached to the vertebrae and float at the front. And you can see those on the diagram there. Okay, exam tips. When you come to the exam, all 12 pairs attached to the vertebral column at the back. So again, if underneath this, if I move myself, we have the pause button for you to take some notes. Right, welcome back. Axial skeleton, the vertebral column then. There is always a question in the exam about the vertebral column. So there are 5 parts to it. The vertebral column has a specific amount of vertebrae in each group. There is 7, 12, 5, 5, and 4. If you can quickly tell me and add up those, how many in total? This protects our spinal cord, and each vertebrae has a hole in the center which allows the spinal cord to pass through. So, little task and a pause. Just move myself out of the way. Right, task, come up with an anagram for remembering the different parts of the vertebral column and how the number of vertebrae in there, and then complete the worksheet, color and label the spine. Press the pause button and I'll get back to you shortly. Okay, the appendicular skeleton. I'll just move myself out of the way. So there are 4 parts to the appendicular skeleton, which are the upper and lower limbs and the shoulder and the pelvic girdle. The main function of the appendicular skeleton is the movement. So we have at the top here, we've got the clavicle. The role of the clavicle is to keep the scapula the correct distance from the sternum, and it provides a point of attachment for many muscles of the upper arm and the back. Again, just move myself out of the way. So situated at the upper body here. Okay, one end is connected to the sternum and the other end is connected to the scapula. Right, appendicular skeleton, the pelvis. So this pelvis, again, I have to keep moving myself out of the way. Function to protect the lower internal organs such as the bladder, reproductive organs, and when pregnant, the developing fetus. So the bones in there, the sacrum, the ilium, the ischium, and the pubis. And there is a pause for you to take some notes down there. Okay, welcome back. So we move on to the legs. This consists of 4 bones, the femur, the fibula, tibia, and the patella, all of which you should be familiar with, again, if you've done the level 2 courses, and you should also know them from your science. So we have The femur, longest bone in the body, it forms the knee joint with the tibia. It's also one of the strongest and hardest bones of the body as well. We have the patella, which is the bone that floats over the knee and lie within the patella tendon and smooths the movement of the tendons over the knee. So it allows you to bend and move and kick. Also, we have the tibia, which is the weight-bearing bone of the lower leg. As you can see here in the drawing, being the weight-bearing bone, it is slightly bigger. And then we have the fibula, which is the non-weighing bone of the lower leg and helps form the ankle here. Right, if I can just move myself out of the way. There's a pause there. If you can get yourself some notes, and then we can move on. So again, welcome back. We've got the arms. So in order for the hand to move, the radius, the right moves across the ulna, which is the under. So the way to remember, radius is the right, and then the ulna is the under, which is the this bone here. And the humerus is your long bone, which runs to your shoulder. So humerus, radius, and ulna all form the elbow joints. And if you can get yourself some notes, pause it, and I'll get back. Welcome back then. So we've got the hands there. It consists of 3 areas made up of different kind of bone. We have the distal phalanges, we have the intermediate phalanges, we have the proximal phalanges, and then we have the metacarpals, and then we have the carpals. Okay, so that's how the hand is made up. Lots of bones there. Again, press the pause button and get yourself some notes, diagrams, and we can move on. Question time then, appendicular. What is the hip also known as? What bones are part of the shoulder girdle? What bones are part of the other limbs? And what bones are part of the lower limbs? So if you press the pause button, and we can then move on. So the answers. So the hip is known as the pelvis, the clavicle and scapula is part of the shoulder girdle, and then the upper limbs are the humerus, radius, ulna, carpals, metacarpals, and phalanges, and then the lower limbs are femur, patella, fibula, tibia, tarsals, metatarsals, and the phalanges. Okay, to finish off then, there is 2 more worksheets to complete, which is the axial and the appendicular skeleton, and the structure of the rib cage and the vertebral column for you to work through. Okay. So thanks for watching. Little snapshot of what you could be doing, and I hope to see you all in September, ready to start the course for real. Thanks a lot.